Debbie Sievert, a clinician with the Chesterfield County Mental Health Substance Use Services Program. And today in the video, I'll be training you on how to recognize and respond to an opioid overdose emergency with the administration of naloxone, or also known as Narcan. Opiates are a type of substance called central nervous system depressants, also commonly known as downers. These can include heroin and prescription pain medications such as hydrocodone, oxycodone, fentanyl, morphine, methadone, and buprenorphine, to name a few. An opioid overdose happens when an excessive amount of an opioid or a combination of other opioids and other substances overwhelms the body and causes it to shut down. Opioids can cause breathing and heart rate to slow and eventually cease entirely. The cause of death most frequently cited in opioid overdose is lack of oxygen. Narcan is a medication that counteracts the life-threatening symptoms of an opioid overdose. When Narcan is administered to an overdose victim, it removes the opioids from those opioid receptors in their body. It then blocks these receptors, which stops the effects of the opioids and allows the overdose victim to breathe normally in as little as 30 seconds. However, there is some limitations in regards to Narcan. One of those limitations is that if somebody has used other substances other than opioids, the Narcan is only going to be effective on the opioids that are in the system. The other limitation of Narcan is it has a really short half-life. What I actually mean by that is the medications can start wearing off within a very short period of time, usually 30 to 45 minutes. Opioids actually stay in the system longer than that. So when the Narcan starts wearing off, it leaves those opiate receptors open again for the opiates in the system to reattach, for where an individual can end up going back into an opiate overdose. However, one thing that you need to know, Narcan is completely safe. Even if you administer Narcan to an individual that is not actually in an opioid overdose, it will not affect them. So what does an overdose look like? Some of the signs that an individual is in an overdose are, first, face pale and clammy, breathing is infrequent or has actually stopped. The individual is unresponsive to any stimuli, there is slow or no heart rate or pulse, fingernails, toenails start turning bluish purple in color, and lastly is a gurgling or a deep snoring sound. This sign, I think, can sometimes actually be overlooked or misrepresented, for where people think that individual is just sleeping. However, this is, if you hear any unfamiliar sounds while somebody is sleeping, it is worthwhile to go ahead and try to wake that person up so that you are not missing an opportunity to intervene or save an individual's life. So, what you will need to do if you actually do encounter someone you suspect is in an opioid overdose. First, you're going to need to check for responsiveness. You can do this by shouting their name, tapping on their shoulders, or pinching an earlobe. Another way is to actually give a sternal rub. Make a fist with your knuckles, kind of rub hard up against the person's sternum or their breastbone. This sometimes is enough to wake the person up. Once you do that, you will then need to check for their breathing. Put your cheek next to their nose and their mouth for where you can actually feel for breath, but it also allows you to look to see if the chest is rising and falling. If the person does not respond and is not breathing, place them into the recovery position by rolling them on their sides, placing their hands under their head, top leg over their bottom leg. This helps to keep the airway open while you then call 911. Once you get 911 on the phone, stay on the phone with the 911 operator. They will then really walk you through and tell you what steps they want you to do. However, if for any reason you are not going to be able to stay on the phone with 911 or something happens to that call, what you will then need to do. You will then place the individual on their back and give 2 rescue breaths. This can be done by tilting the chin upwards, pinching off the nose with one hand, and giving 2 even regular size breaths. You can kind of look out of the corner of your eye to make sure that that chest is rising. If it is not, you will need to tilt the head a little bit more to make sure that the air is going into the lungs. Once you then give those 2 rescue breaths, this is when you will get your Narcan and administer your first dose of Narcan. What you'll do is 2 fingers on the top, the thumb goes on the bottom plunger, and it gets inserted into the individual's nostril where your fingers touch the bottom of their nose, and you just press. That is how you administer the first dose of Narcan. If the individual does not wake up and start breathing on their own within a few seconds, you will now resume rescue breathing. What that looks like is, again, opening up the airway by tilting the chin, pinching off the nose with one hand, and giving 1 rescue breath for every 5 seconds. It is 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000. You will continue with your rescue breathing for approximately 3 minutes. If the individual does not start breathing on their own within about a 3-minute time span, that is when you will actually get your second dose of Narcan and administer that second dose in the other nostril. Again, just like the first, fingers on top, thumb on the bottom, insert it into the person's nose for where your fingers touch the bottom, and push. You will then resume rescue breathing, which is that 1 breath for every 5 seconds until the person actually starts breathing on their own or help arrives. There are a couple other alternatives that you can do if you don't have Narcan or don't maybe feel comfortable kind of walking through the steps that we have just discussed. 1, you can always take the individual to the ER for them to receive medical care. Another option that you can do is, if you don't feel comfortable staying, at least call 911, let them know that there is a potential overdose victim. Again, put that individual into the rescue position so that it helps to keep their airway open. And then you can leave. You know you've called 911, so EMS should be on their way. The other one is, if you do have Narcan, for where you could also go ahead, administer the Narcan to them. If they start breathing and seem to be okay, you can wait with that person for at least 3 hours to make sure that they do not go back into an overdose. Thank you for attending this training, and for questions or if you would like a prescription of Narcan mailed to you, please contact at either the phone numbers or the email address provided. Thank you.